Okay, thank you everyone. I think we'll make a start now. So thank you everyone for attending this workshop. I hope you find it useful. So just to give a bit of an overview of what we'll be doing, we have Julia Simpson, who will be chairing. So that's, hopefully you can see a video of Julia. We have Tom, who will be presenting some of his work. And then we also have Claire, who will be presenting some of, I guess, the policy contacts around some of the things we'll be discussing. So I guess just kind of general housekeeping rules. Sorry, I'm just seeing, it seems more people are joining and I'm getting flashings up, which is why I'm looking at my screen in a funny way. That if you can keep your videos off during the presentations, and if you have any questions that you think of, you can put them in the chat box and someone will look at them. We have 30 minutes for each of the two presentations and then about 20 minutes for Claire's presentation. And then at the end, we're going to have some breakout rooms and we're going to assign you to breakout rooms and we're going to discuss some of the questions that were on the sign up sheet, and we'll refresh your memory just in case you need that. And yes, so, and I guess just to tell you again a little bit about this project, this is an SPHR funded project that we were looking at data sets and kind of ways to classify the food environment for future evaluation work. So I'll be starting by presenting some of our analysis looking at the validity of using Food Standards Agency food hygiene rating scheme data, as well as a preliminary analysis of Newcastle's supplementary planning documents to try and promote a healthy food environment. Okay, and now I will start. Okay, so what is the food environment? So basically, the food environment is any opportunity to obtain food. So this includes both the physical environment, socio-cultural environment, so kind of cultural preferences for different types of food, economic and policy influences at the micro, so that's the individual, and the macro, that's more a systems level. And the environment in which we live influence our food choices. And part of this is through what food we have access to and accessibility. And that's what we'll be focusing on in this presentation. Okay, so then how does this relate to kind of, how does the food environment relate to policy? So since 2013 in England, public health responsibilities were transferred from the NHS to local authorities. And because of this, they were also tasked with promoting healthy weight, physical activity, and a overall healthy built environment. And there's been increasing interest in how local authorities can shape the food environment, because this is also within the context of decreasing budgets. So one way is particularly by engaging with small businesses and collaboratively working across different departments, many of who, such as planning, had not been previously kind of working within the health sphere or thinking of health when making decisions. So as I said, planners are new to health. So basically up until the last 10 years, planning decisions mostly were based upon environmental grounds such as access, noise, but not really thinking about how the environment influenced health. So going forward, as planners are new to health, it's important to understand what works and how the planning system can influence health and how it might not be able to influence health. So as since 2013, public health teams and planners have worked together to create planning guidance, which are called supplementary planning documents, which fit within the plans for the local authority in terms of how they want their built environment to look. So what is known is that important health inequalities exist around access to healthy foods. And we do know that unhealthy food sources tend to cluster in more deprived areas, and that this may be a contributing factor to health inequalities. And given the existing evidence, what has been done is that planning policies tend to focus on restricting new hot food takeaways. So hot food takeaways are food outlets where the primary business is the selling of food to be consumed off the premise. And there is a lot of existing evidence that shows that consumption of this type of food frequently leads to a poorer diet and poorer health outcomes. So given this health evidence and the use for multi-sector working, approximately 50% of local authorities have these SPDs, so supplementary planning guidance, to restrict new hot food takeaways in order to promote health in the local area. However, with this increasing popularity of local authorities using these planning guidance, there has been no evaluation of their effectiveness in managing and promoting a healthy environment. So since 2012, the Food Standards Agency Food Hygiene Rating Scheme data has been available online. So it's a statutory requirement for all businesses that sell food to be inspected 28 days within opening. And then depending upon their rating, they're subsequently inspected anywhere between 3 months and a few years. And it also depends on what type of food that they sell. So businesses where food is not their primary business will be inspected less frequently than those where it is as well. But it includes then everything that has food. So it's not only just restaurants, takeaways, cafes. It also includes convenience stores, supermarkets, schools, community centers, any place that has food available, either to purchase or consume, because they don't necessarily even need to be selling it on premise. And this is just the website, if anyone wants to have a look at it. And it's all available freely to download in an Excel file. So in our project, what we did, we first explored the validity of using this data to evaluate interventions of the food environment. So what we were interested in is how representative the data is. So it is a statutory requirement that all data should be there, but we wanted to double check that what was present in the field was also present in the data. And importantly, that most of the planning guidance is around distances. So for example, the most popular type of planning guidance is exclusion zones around schools. And these are usually within 400 meters of a school. So we have to be able to make sure that the data shows that is accurate within 400 meters, because otherwise you would not be able to do an evaluation using this data if the geographical coordinates were greater than 400 meters, because you'd be creating error and you wouldn't be able to assess how effective these planning guidance were. And then after we assessed the validity of the data, we started to do a basic evaluation of the impact of Newcastle's planning guidance on the type and number of new food outlets and how it impacted on existing food outlets as well. So first I will discuss the validity component. So we did a field audit to assess validity and spatial accuracy of the data in 5 lower layer super output areas. So these are geographical areas which are made up of approximately 1,000 people. So they vary in size. So rural areas have larger LSOAs and urban areas have smaller LSOAs. So we looked at them, a few in Gateshead and in Northumberland, and we looked at both urban and rural areas. And we also looked at those areas that were more deprived and less deprived based upon the index of multiple deprivation, and rural areas are based upon the rural classification code. And all potential premises selling food in the chosen LSOA were recorded and compared with those in the Food Standards Agency data. And so then we assess validity against the field data using positive predicted values and sensitivity, and spatial accuracy was evaluated via mean straight line differences. So we basically just looked at what the geographic coordinates were when we went to the site and compared those to the data, and then looked at the mean difference between the two. So the results we found is there were 182 food outlets present in the field, of which 162 were in the data and 20 were absent, giving a sensitivity of 89%. 8 outlets recorded in the data were absent in the field, and that gives a positive predicted value of 95%. And the spatial accuracy was less than 100-meter difference. So our geographic coordinates compared to the ones in the data were on average, I think it was 71 meters for 77% of outlets. There was one outlier, which was a mobile catering site in Gateshead, but there was 15 outlets there, so that kind of led to a larger difference between rural and urban areas. But when we took that out, there was no difference between rural and urban. And we also found no difference in the distribution of distances. There was no difference in spatial accuracy when comparing across by deprivation levels. So what this means is that, at least for the northeast of England, that the data should be valid and spatially accurate for evaluation and planning guidance to promote a healthy environment. Because, as I said earlier, that most of the planning guidance limits the change of business premises within a 400-meter distance. So therefore, since we found that the mean distance was less than 100 meters, it should be sufficient for what we want to do. So that then brings me to the second part of the presentation, which is looking at the evaluation of Newcastle City Council supplementary planning document. So what is Newcastle's supplementary planning document? So basically what it does is that the council states it will not grant planning permission for the change of use of premises where the primary business is a sale of hot food for consumption off the premises. So that is a takeaway. So what that also means is that existing takeaways can still continue to operate, but a new takeaway will not be able to open in one of these exclusion zones. And then it also looks at the overconcentration. So they will not grant planning permission to new takeaways in areas where they find that there's already too many, and that if there's already 2 takeaways next to each other. And these are within school exclusion zones. So that is within, so it's only secondary schools, not primary schools, because the idea is that secondary school children have more autonomy over where they go after school, and kind of, so they are more likely to be influenced by the food environment than primary school children. So this is taken from the supplementary planning guidance for Newcastle City Council. And this shows the 18 exclusion zones. It says 19, but they missed out the number 10, so there's actually 18. And these are around the 18 secondary schools in Newcastle. And the zones are a 10-minute walk or approximately 400 meters from the secondary school. So what we do is we use the Food Standards Agency food hygiene rating data for Newcastle. Oh, I should also say that Newcastle supplementary planning guidance came into effect in October 2016. So we use data from 2012 to 2019. So we have before the implementation of the supplementary planning guidance, which is 2012, 13, 14, 15, up until October 2016. And then after, which is from November 2016 to 2019. And we do, this data is the FSA data is constantly updated, but we do not include the data for 2020 because of the COVID-19 pandemic and the fact that planning laws temporarily changed in March 2020 to allow all businesses to operate as takeaways that sell food for 1 year just because of the pandemic. So we didn't want to include this data because it's not going to be reflective of the food environment potentially. We don't know what's going to happen, I guess, next year, but just in relation to the development of the planning guidance. So what we have is we have data on 358,832 observations for 44,854 postcodes in Newcastle over 8 years. So what we know is that some postcodes will be inside one of those exclusion zones, which are the blobs on that map I showed earlier, and others will not. So we use a quasi-experimental approach to look at the number and type of outlets and areas that are in these exclusion zones compared to those that are not. And we also look at then with those that are not in the exclusion zones, those that are within 250 meters of an exclusion zone. So we call those spillover postcodes because it's saying that they're really close to an exclusion zone. So it's possible that kids could walk there after school, but they're not quite in it to see how that might influence on what businesses do, both takeaways and other types of food outlets. And then we look at those farther away, which should not be impacted by the exclusion zones in the same way. So this slide shows what we did. So the red dots on the blobs on the top, so the exclusion zones you can see are mapped up or matched up to those that are on the map. So we've put these into a statistical software package, and the red dots are those food businesses that are within the school exclusion zones. The oranges dots are those which are just outside, so that's within 250 meters, and the greens are the ones that are further away. And you can see kind of that these two blobs, I hope you can see my arrows, I'm not sure, here are those, that's kind of the Newcastle city centre area around the university. So there's, I guess, a high concentration of outlets here. And then this just shows that in a different way. So this is the density of outlets, and we can see that in this city centre area is the highest concentration. As you move further away from the main city centre, there is a lower concentration of outlets. And then this slide shows in a few different ways how many new takeaways there were in Newcastle over our study period. So that's from 2012 to 2019, obviously, because we don't look at 2011. So the first new year where we can see takeaways is 2013. And as you can see, in reality, there are not many new takeaways that open across all of Newcastle. So you can notice that 3 have opened in one of the exclusion zones, and that's because there is an exception with the supplementary planning guidance that takeaways can open up in the exclusion zone if they're in a retail zone. So that's a designated area for business. And so you can see that in all the spillover, so close to it, the controls, and in the exclusion zones, there's not many new business open. So this figure over here shows that across all the postcodes in Newcastle, how many open. You can see that on average, that less than 1 opens in a postcode over each year. And then this one just shows the number of new businesses that open, and you can see just by looking at this figure that this is 2016 is when the legislation came into effect, and in the treated postcodes, none opens that year. And there was a rise in both the spillover and control compared to the previous years. And you can see that as well again in 2017, but then that all seemed to kind of slow back down again. So it's hard to say why this might be, if it's the planning legislation or it might not be. So then this just shows, so this is from our estimation model, which is estimated using the quasi-experimental technique difference and difference. So it basically just compares the number of outlets before and after the legislation came into effect. And as we can see, this is on the existing number of outlets if the legislation caused any change. And in a sense, we wouldn't necessarily expect it because it only relates to new premises, but it is possible that it may have if it changes kind of business expectations, but we wouldn't necessarily expect to find anything, and we don't find anything. So with one exception, so the treatment are the postcodes in the exclusion zone, and the spillover are those near the exclusion zones. And the only thing we find is that there are slightly less mobile caterers after, and that's statistically significant, the introduction of the SPD, but and then there's no difference in any other type of food business. And for the number of new outlets, so this is new outlets that opened after 2016, as all the lines pretty much pass through zero, the confidence intervals, we find that there's no change on the number of outlets. But as we saw, we wouldn't necessarily expect an impact unless there's two reasons why we might, is that if businesses who were going to operate as a takeaway decide to open up as a restaurant, you might see an increase in restaurants in these treatment in the exclusion zones, or possibly the spillover, or we might see an increase in number of outlets in spillover zones if businesses decided not to open in the exclusion zone and instead open in the spillover zones, but we don't actually find that either. So what we found is that the SPD has had little impact on the food environment. That doesn't necessarily mean that it's not the right thing to do or it's a bad thing, just saying that in this very short term that we haven't found anything. And that's not to say that in the longer term it won't do anything, but it's kind of, I guess, important to think about, especially post-COVID and the impact that COVID has had on the hospitality sector, of how planning and public health can work together to make sure promote a healthy environment that is also economically sustainable. So then some things to think about is how applicable are these results to other local areas with a similar SPD? So kind of it would be important to look at underlying trends in existing outlets as well to see if this kind of finding is universal. And then as well, this is one type of SPD, which is the most popular amongst local authorities, but there's other different types of SPDs, such as the one in Gateshead, which is more restrictive and limits the density of outlets across the whole local authority, and see how that might impact on the food environment, if it's any different, or if we find a similar effect of what we've seen for Newcastle. And the other thing to keep in mind is, as I mentioned, planning is new to health. So to think about kind of going forward, how planners and public health teams can work together, kind of have realistic expectations of what is achievable and what the two can do together to kind of create a healthy environment. And the food environment is ever changing. So what is not known is changes in planning, how long those will last, if they'll last more than a year, and what that means kind of for this type of legislation or planning guidance. And also how post-COVID might change consumer preferences for different types of food. If people get more used to kind of eating at home, what that will mean for the food environment. And as well, thinking about how do we best promote healthy choice that is economically sustainable as well for the hospitality sector, which is a big employer. And that is it for me.
Thank you, Heather. Not sure, can you see me?
I can.
Yes, okay. So that was a great presentation, very clear and very informative. And we've just got a couple of minutes for questions before our next presentation. And feel free to type them up in the chat. Anyone who's got any questions? I don't see any questions yet, but I guess I'll make a start and then we'll see if we get anything as we go along. So do you think now that in the post-COVID world, these planning permissions will become more important and will have a bigger impact than perhaps you've seen in your preliminary evaluation in Newcastle?
I think potentially it might actually be the exact opposite, because they're in the planning white paper, they're going to change kind of how businesses can get planning permission, which will actually make it easier for restaurants to open, and drive-throughs is another kind of area where there's seen, especially during lockdown, a proliferation of applications for drive-throughs. So it might mean that kind of we need to think about different ways to both, I guess, keep the economic kind of interests of, you know, having these kind of businesses, as well as the health interests, and think of different ways of how to, I guess, work together to make sure that we have jobs and a healthy environment.
Yeah, and do you think the new obesity strategy will have any impact on this as well?
Limited, because I guess the obesity strategy, the national one, is focused more on calorie counts rather than kind of on limiting or thinking about how the environment influences choices.
Yeah, yeah. Well, perhaps with this data, we can maybe give more of an insight of how, you know, it could work in the future. I think we've got something in the chat. So Anthony says, is it not also important to consider the rise in online takeaways and mobile traders? Takeaways could be physically located outside exclusion zones, but still serve residents in the exclusion zone, or obtain street licenses to trade in exclusion zones if the licensing team do not have similar exclusion zones.
Yeah, so I guess that is an important issue. I was going to say, we have in our in the data set, they do have these, I guess, kind of dark kitchens or whatever you want to call them. I'm just getting to trying to find the slide. So in it, those kind of outlets are the manufacturing. So a lot of those are kind of places where they make food which is sold in these mobile takeaways, and you can see in the locations that they kind of are on the periphery of city centers. But yes, you don't know then kind of the reach. But I guess the whole idea behind the legislation is that this is, especially the school exclusion zones, is around schools for children. So, you know, that's not quite such an issue, because it's what they can get when they're walking home from school, not necessarily what they're getting, you know, when they get home from school and call these things. So it's sort of looking at two different things. But yes, thinking about the future and kind of how we make a healthy environment, it's important to think about how these work and how people use them.
Okay. Is that okay, Anthony?
Yeah, that's fine, thanks.
Okay. I don't think we have any more time for questions for this presentation, but I guess we'll come back to it after we've had all the presentations.
So yeah, thank you for inviting me to speak today. My name's Claire Baity. I work at Newcastle City Council, coordinating the UK Healthy Cities Network. So I provide the secretariat for that for towns and cities across the UK. I'm also doing a little bit of work in public health on wellbeing, but today I'm predominantly here in my role with regards to healthy cities. And I think the reason why this work was of interest to us was I'm not a specialist in food and I'm not a planner, but I think it's always useful for our network to make academic links, especially when they relate to the wider determinants of health and opportunities to improve health in all policies approaches. So I'm just going to talk a little bit today about what the Healthy Cities Network is, some of the place-based work that we've been involved in the last sort of 18 months or so, some of our members, a little bit how that relates to the food environment, why it's important, and what I think we can kind of learn from next, and kind of what some of the challenges might be from COVID. So just a little bit of background, first of all, about the Healthy Cities movement. It's a politically led movement. It has been going for around 30 years, and Newcastle has been involved, I think, since 1995, so we've got quite a long history within the movement. And it's got three basic principles for this phase. It operates in 5-year phases. So it's to reduce it's to reduce health inequalities, lead by example at city level, and also feed that in regionally and nationally, and to support WHO strategic priorities as well. It's part of a wider European network, so you can just kind of see the map of all the cities that are members there. Quite a diverse range of cities. So as you can see, it kind of, the WHO European region extends quite far east, and within that you've got sort of Southern European countries, the near Middle East, Nordic countries, Western Europe. So what is quite interesting about the network is you've got such a range of health systems and issues and priorities in there, and it's really useful for cities within our UK network to make those links with different ideas and systems and contexts by sort of building relationships and exchanging knowledge. And so cities that are members of the network in the UK, they subscribe to the political vision for the programme, which lasts 5 years. The current phase that we're in lasts from last year, from 2019 to 2024, and it's framed around what we call the 6 Ps, which works particularly well if you're in an English-speaking country within the network. So the 6 Ps are kind of there for everyone to see: the peace, planet, place, people, participation, and prosperity. And as you can see, sort of in the inner wheels, you can see that in the inner parts of the wheel, you can see kind of the mechanisms for how we achieve those things through a health lens. So I feel like we've gone from quite narrow up to sort of really broad concept of what health is. But ultimately, I guess, the food environment and the conditions in which people live their lives is kind of instrumental in many of these domains. So as I say, the programme's designed really to reduce health inequalities, but to support WHO's strategic priorities. So it's aligned to their 13th General Programme of Work, and it is also aligned to the 2030 Sustainable Development Goals, which I know a lot of our member councils have also politically committed to as well. So it's kind of like a useful mechanism to sort of apply a health lens to the SDGs as well, not just in relation to Goal 3, which I guess is mainly the health one, or Goal 11, which is the cities one, but there's actually kind of read across across most of the SDGs. And I really just wanted to highlight, I guess, Goal 2 in relation to food insecurity, and Goal 3.4, which I think really is where this food environment work ties in, which is about reducing by 1/3 premature mortality from non-communicable diseases by 2030. And I believe from WHO that 63% of global mortality can be attributed to NCDs, and obviously they're a major priority for most of us in developed countries as well, including the UK. So within that, we have like a framework that cities work towards to help inform their policy and strategy underneath the 6 Ps. I've just put that on the slide, which I hope is useful. And I've coloured in green kind of the ones where the food environment kind of fits. So as you can see, we've got healthy diet and weight within people. Within place, we've got healthy places and settings, integrated planning for health, which then kind of fits in another one of the Ps as well: commercial determinants of health, healthy urban planning and design, and health promoting municipal policies. And I think it's important to say that the network is and the aims of the Healthy Cities movement are broader than place-based and built environment, but at the same time they do form part of that. And a lot of the work that we need to do and that we're trying to do is to kind of make those links between planning and public health, and to sort of adopt health across all policies within local government. So as I say, the UK network is kind of like a smaller entity that feeds into the European level. It's a network of cities and towns across all 4 nations of the UK. So it's, I guess, work into the devolved nations policy agendas as well. And we have a number of flagship cities within that who have direct links with WHO and who go through quite a rigorous designation process where we are assessed to basically outline exactly what we're going to do in each phase of the programme. So Newcastle is one of those, for example. And sort of supplementary to that, we have a wider group of cities that are networked cities into the UK network, and the UK network acts as a conduit to WHO. So we have events with other countries who are members, knowledge exchange, peer support, fortnightly webinars with other WHO cities across the European region, participation in research and events as well. And we also work with some of the WHO collaborating centres as well. At the moment, predominantly with the University of the West of England, but we have also done some work with Liverpool John Moores as well over the summer on violence prevention. So just moving on really to some of the work that we've done over the last sort of 18 months that's been quite place-based and focused. Some of it has been not necessarily specifically in relation to the food environment, but I think relevant to that agenda. It's worth saying as well that the network's quite diverse. So we have a lead representative from each city who is a member, and in lots of English local authorities, that person tends to come from public health, from a wider determinants background, or from policy, such as my substantive role is. But in other parts of the UK, we have representatives from academia in Scotland, Glasgow in particular. Northern Ireland, we have community interest companies where the participation with the WHO is kind of operated as its own on its own outside of the local government. So it's kind of like a really interesting mix of people, and with a range of different backgrounds and areas of expertise that are all working to sort of a common goal, but with different sort of information to share. So in the last sort of 18 months or so, we have had Belfast Healthy City sort of sharing learning that they've done and resources that they've been able to develop in terms of communicating about healthy places and healthy children. Locally, we've done a lot of engagement on the Place Standard tool and participated in training on Glasgow. I'm not sure if anyone's familiar with that. It's a tool that was developed by Architecture and Design Scotland and NHS Scotland. It's been adopted by WHO Healthy Cities, and I think has been translated into I think 13 different languages and countries across the network. So the value of kind of participating in that training is to learn and understand more tools about how we can communicate with and engage with people about how to actually evaluate the environment in which they live, and kind of looking at different applications of that tool. And then at a recent seminar that we held, led by our member city Warrington, we had a place-based focus that was partly on economic regeneration, but also looking at one particular issue, which I think isn't quite food environment, but I thought it was really interesting and almost tied in, looking at access to drinking water in public spaces and how that's been restricted, and the impact on consumption of sugar-sweetened beverages. And also kind of, because the Healthy Cities movement takes such a broad view, looking at the impact of that and bottled water consumption on planetary health as well. So not just thinking about the consumption element of food and drink, but kind of what are the wider impacts even beyond that. So that's just kind of a little flavour of what we've done recently. Obviously there's been quite a focus on COVID as well, as you can imagine. And then looking at sort of city level policies that are within the framework, they kind of fall into 4 categories, which I think do sort of overlap, but the ones that are kind of relevant to the food environment are looking at the built environment, which I think is where this kind of fits today, the municipal procurement, and the role of anchor institutions, and then also tackling the commercial determinants of health as well. And I've just put like a little definition of the commercial determinants of health there, because I've read different kind of definitions of that, and I think this is how WHO defined it in our implementation framework, which really is just summarising the tension between the restriction of a particular resource versus the economic incentive for more of that. And then just really wanted to cover kind of why I think the food environment matters from a really broad healthy cities context. So I guess the reason why I think this data is really interesting is because we know that there's the issue around the clustering of outlets and density and that kind of is clustered around areas that are more deprived as well. But I think when we're thinking about it from a sort of a step even further back, is looking at how that kind of fits in with the whole environment beyond the food environment, looking at it as, from a place level as a whole. And I think what we find is that there's a concentration of unhealthy exposures in the same communities that kind of go beyond food. So whether you're looking at gambling or alcohol or air quality, it's often those same populations that have been most impacted. So how can we kind of address that across multiple levels? And equally, it's not everyone in those areas is impacted equally, and it's often the most disadvantaged individuals in terms of sort of age, low income, mobility, people without cars, people with disabilities, and so on. And then also the issue of I think this tends to be not just in response to kind of healthy weight and obesity, but also access to a range of kind of quality food within a reasonable sort of distance and area within your neighbourhood, and how does that interrelate with food poverty as well, which I think is a huge issue that is just really kind of, if it wasn't already at the forefront, which I think it was, it's really just sort of exploded during the period that we find ourselves in now due to COVID, especially around people self-isolating and so on. And then also kind of looking at in the long term, how does the food environment and access to the type of food available sort of shape the food culture of households and individuals and societies as well. And then just looking at kind of why I thought this data was kind of interest to us when Heather sort of first approached me, and why I've kind of tapped into sort of our public health kind of food person who can't be here today, but who has been involved in this work with Heather as well, is because I think a lot of the time, a lot of the things that we measure and that are available on things like fingertips are the health outcomes themselves are quite far downstream, the things that we can actually sort of measure and see and look at the trends. So just thinking about things like the National Child Measurement Programme, adult obesity rates, cardiovascular mortality, the percentage of mortality from causes considered preventable. And I think what we find is that it follows the social gradient, but it's kind of like all of the different components kind of, and the complexity into those factors leading into that, we don't necessarily have a very developed evidence base on the kind of all of those different factors. And I guess I just wanted to put this slide in really about with the foresight mapping, which I'm sure everyone's kind of familiar with really, but just to sort of look at sort of that complex web of factors, and if we can kind of just get more useful information and understanding and data, and in a really usable format as well, particularly I think within local authorities where, especially at the moment, we're dealing with quite a lot of kind of competing pressures, and we're not necessarily all data experts as well. Having just access to more information about different parts of the system and evidence supporting even just sort of small parts of this incredibly complex system help us inform decision making and make better policy. So yeah, just wanted to highlight that really. And then I apologise if this isn't a full list, but I just kind of did a bit of a quick sort of summary of some of our English members who have SPDs in place so far, and just there's some examples there. So a lot of our members are in the north, where some of the health inequalities are most apparent. So Newcastle obviously has an SPD, Manchester, Warrington, Wakefield, and then Liverpool has actually provision within the local plan. And then finally, I just wanted to sort of really raise some issues about where I think what some of the issues might be coming up around the food environment, which I certainly don't have the answers to, and hopefully it'd be quite interesting to maybe discuss a little bit in the breakouts, is what might the food environment look like post-COVID, and how can we think about this? Because I think at the moment, certainly in Newcastle, a lot of our thinking around food and the food response at the moment is very much concentrated on the here and now, and just making sure that people do actually have access to food, and it's not a barrier to self-isolating. And obviously we know there's a huge issue with food poverty as well, and that's going to continue to bite as the impacts of the pandemic go on. But just kind of thinking that little bit further ahead, what's going to happen in terms of takeaway provision after next year, what might be the economic impacts on the hospitality sector, which bits of the sector might be more impacted than others, might takeaways be more resilient, might we see sort of more takeaway provision, and then kind of looking at some of the other effects, like the potential for maybe local neighbourhood type outlets, again thinking wider than takeaways, really more in, I guess, different classes, but they might be able to thrive, or would there be kind of more diverse environments, food environments, which could actually be a good thing, but then perhaps there's an inequalities element to that, because are those going to be located predominantly in areas where people are able to work from home more, and maybe have a lesser concentration of the economic effects of the pandemic on unemployment and so on, and fewer key workers and frontline workers maybe. And then I guess the impact of the kind of upcoming the white paper, which I think Heather touched on, and how that might sort of impact, and again the measures in the obesity strategy as well, just sort of thinking about those, which I agree are kind of too narrowly focused on individuals and behaviours. And then finally, the one thing I did want to kind of highlight was I think in some ways it's quite challenging to sort of work in a health across all, in all policies environment right now, when in the midst of the pandemic, but at the same time I think there are opportunities as well for working across departments and across sectors, and I think we've started to see the results of that, and hopefully the public can kind of see results of that in different places as well, in terms of the active travel stuff, and kind of thinking about what's possible in terms of low traffic neighbourhoods, concepts like 15-minute city and so on. And I think when you kind of see all the cycle lanes popping up, I think there's like a great one at the coast, along the coast in the northeast, which some of you might be familiar with, in North Tyneside. It's kind of given a bit of a vision for what could be different, and it's kind of made apparent, I think, and just more obvious, the interrelation between health and transport and environment and planning, and how can that maybe be applied to other sectors such as food. And that's everything from me. If anyone has any questions, that's great.
Thanks very much, Claire. That was excellent.